Which of the following is a key clinical feature of endometritis? A. Vaginal itching. B. Fever and uterine tenderness. C. Painless vaginal bleeding.
Answer.
A. Fever and uterine tenderness. Fever and uterine tenderness are hallmark signs. Vaginal itching suggests candidiasis, while painless bleeding may indicate other pathology. According to NICE, what is the first-line antibiotic for postpartum endometritis? A. Oral metronidazole alone. B. IV coamoxiclav. C. IV gentamicin and clindamycin.
Answer.
C. IV gentamicin and clindamycin. IV gentamicin and clindamycin is first line, NICE. Coamoxiclav may be used but is not always sufficient for anaerobes. Metronidazole alone is inadequate. When should prophylactic antibiotics be given in C-sections to prevent endometritis? A. Postoperatively. B. Before skin incision. C. After cord clamping.
Answer.
B. Before skin incision. Before skin incision, this reduces endometritis risk by 60 to 70% compared to post-op administration.
If you're enjoying this video, subscribe to PLAB Diaries. Are you ready for the next question?
Which diagnostic test is most useful for confirming endometritis? A. Blood cultures. B. Endometrial biopsy. C. Clinical assessment and bloods.
Answer.
C. Clinical assessment and bloods. Clinical assessment and bloods are key. Biopsy is rarely needed in acute settings. Which of the following is not a risk factor for endometritis? A. Multiple vaginal examinations. B. Chorioamnionitis. C. Regular use of tampons.
Answer.
C. Regular use of tampons. Tampon use is not a risk factor. Multiple vaginal exams and chorioamnionitis are established risks. What is the most appropriate next step if a patient fails to improve after 48H of IV antibiotics? A. Switch to oral antibiotics. B. Add metronidazole. C. Imaging like pelvic ultrasound.
Answer.
C. Imaging like pelvic ultrasound. Pelvic ultrasound to rule out abscess, retained products. Broader spectrum antibiotics may also be needed.
Get ready. It's going to get harder now.
The gold standard diagnostic criteria for endometritis are primarily blank, supported by blank.
Answer.
Clinical, fever and uterine tenderness, plus elevated inflammatory markers. Endometritis is diagnosed clinically, fever greater than 38 degrees Celsius plus uterine tenderness. Blood tests support but are not definitive. Imaging is reserved for complications. A patient fails to improve after 48H of IV antibiotics for endometritis. The next step is to rule out blank using blank.
Answer.
Pelvic abscess, retained products and pelvic ultrasound. Persistent fever suggests complications. Ultrasound detects abscess or retained tissue. A key differential diagnosis for endometritis is blank, which can be ruled out by blank.
Answer.
Pelvic inflammatory disease, PID, and cervical motion tenderness on exam. PID involves tubes or ovaries and is positive for cervical motion tenderness. Endometritis is uterine focused. Ultrasound helps differentiate. True or false? Endometritis is exclusively a postpartum condition and cannot occur after miscarriage or surgical abortion.
Answer.
False. Endometritis can occur postpartum, post-abortion, spontaneous, surgical, or after gynecologic procedures like IUD insertion.
What if you could make eye-catching animations faster than ever, even with zero experience? Introducing Create Studio, you're an all-in-one video editor solution. With Create Studio, you can effortlessly craft amazing animated videos in just minutes. Explore its extensive library of effects, templates, AI voiceovers, and creative captions to truly bring your stories to life. Join thousands of satisfied users. What are you waiting for? Try Create Studio now and unleash your creativity like never before. Click the link below to learn more.